During the pandemic, New Zealand became the global benchmark for success. Its low mortality rates and decisive leadership were celebrated by international media as a masterclass in empathy and control. But the narrative of kindness that dominated global headlines had a specific limit. It applied to those already within the country, while creating a distinct blind spot for thousands of citizens trapped on the other side of the border. The Managed Isolation and Quarantine System, or MIQ, functioned as the physical barrier to re-entry. It was a gated isolation protocol that effectively prevented New Zealanders abroad from returning home. Access to a return flight was managed through a randomized lottery system. Permission to enter depended entirely on winning a spot in a constrained pool. For those who lost, the result was long-term uncertainty. Thousands were separated because the system lacked room. This logistical bottleneck challenges the very concept of national belonging. If a government can legally bar its own people from entering during a crisis, the rights associated with citizenship begin to look like privileges that can be suspended. The government's Team of 5 Million slogan was a powerful psychological tool. It fostered a deep sense of shared identity and collective responsibility among those safely inside the fortress. This internal compliance allowed for a high degree of domestic normalcy. Schools functioned, restaurants stayed busy, and the majority of the population felt a sense of security that was rare in the rest of the world. However, this unity drew a sharp line between those inside the team and those outside. Over time, the logic of protecting the collective shifted, and anyone attempting to cross the border, including fellow citizens, was reclassified as a potential risk factor to the country's safety. Protecting the majority became the ultimate priority. When a policy delivers safety to most of the population, the public is often more willing to accept exclusionary measures that target a minority. Outside the borders, the isolation had tangible costs. Tourism collapsed, the international education sector stalled, and the country was physically severed from the global travel networks it relies on. There was also a significant emotional toll that didn't make the official briefings. The stress of forced family separation, the helplessness of being locked out of your own home, created a mental health crisis for those excluded by the policy. During the height of the restrictions, the domestic media largely amplified the official narrative. Daily government updates were broadcast without significant pushback, focusing on the success of the zero-risk strategy. In an environment where the official message is the only one heard, emergency powers can easily become the new standard. Because the necessity of the border lottery wasn't aggressively challenged by the press, the government was able to maintain these restrictive protocols for months. This highlights the difficulty of a zero-risk goal. Risk is an inherent part of a functioning society, and while it can be managed, attempting to eliminate it entirely often requires permanent restrictions on freedom. A democracy's health isn't proven by the comfort of the majority. It is tested by how it treats the minority, the people who are sidelined or excluded when the state prioritizes total security. When New Zealand finally reopened, the world had moved on. Global supply chains and travel systems had already fully adapted, leaving the country to deal with the lingering economic and social effects of its isolation. Leaders at the time were faced with a choice between strict control and the possibility of high mortality. Their decision to prioritize border security successfully prevented a massive loss of life in the early stages of the pandemic. At WebFit News, we believe in looking at the full balance sheet. New Zealand's policy saved many lives, but it also forced thousands of people into a sudden state of exile. We have to acknowledge that both of these outcomes happened at the same time. If we only celebrate the safety without discussing the hardship, we aren't providing a full picture. Acknowledging the ethical trade-offs of a policy is the real difference between informing a public and simply managing their perception. When the next crisis arrives, the same choice will return: safety or freedom. The question is whether we will demand a transparent debate about the costs, or if we will settle for the answers we are given.